So the ZENITH study is a multi-cohort global phase 2 trial. It consists currently of 7 cohorts. In cohorts 1 to 5, patients are treated with non-small cell lung cancer harboring exon 20 insertion mutations either in the EGFR or in the HER2 gene. Those patients were treated in the different cohorts, either in first-line therapy or in later lines of therapy. So EGFR and HER2 exon 20 insertion mutations are known mutations in the non-small cell lung cancer landscape. They account for about 2 to 4% of the mutations each, and they are quite difficult to treat. There are no specific treatments at this moment, and those patients are being treated with either the usual chemotherapy or chemo-IO. Sometimes the regular EGFR TKIs are being tried on these patients, but median progression-free survival and overall survival is rather poor. So Poziotinib is being tested in these patients within the ZENITH trial, and I presented the data of cohort 4 in the trial, and those were patients with non-small cell lung cancer harboring HER2 exon 20 insertion mutations, and those patients were treated in cohort 4 in first-line therapy. Those first 48 patients in that cohort were treated with 16 milligram of Poziotinib QD, and subsequent patients were treated BID, but I only presented the QD dosing schedule outcomes. Primary objective was objective response rate. And the study showed that Poziotinib in QD dosing had an objective response rate of 43.8%. Disease control rate was high at 75%, and the majority of patients showed a tumor volume reduction, and that was 88% of the patients. Median progression-free survival was 5.6 months, and toxicity-wise, the drug showed treatment-related toxicity in all patients, with the majority of patients having a need for dose interruption or dose reductions. And the main drug-related AEs were rash, stomatitis, and diarrhea, with the most common grade 3 AE being rash. Pneumonitis, something that's seen in other TKIs, was almost not seen in Poziotinib, with only a very low rate of grade 3 pneumonitis, only in 1 patient. So overall, it shows that Poziotinib is an active drug in its patient population with a nice response rate of 43% and a high disease control rate. To go further with this drug is first to look at this BID dosing. We've gone from QD dosing to BID dosing for better tolerability. And the interim results from that BID dosing already showed the tolerability was greatly improved with BID dosing. And as in this cohort 4 in the ZENITH trial, the subsequent patients were treated with BID dosing. The first step is to look at that group, I think, at this moment.